All right, let's take a look at Chapter 6. We're looking at diseases of the nervous system and sense organs, and we're in the letter G, G00 to G99. A few different guidelines here. In ICD-9, we saw the hemiplasia codes, hemiparesis, things like that talked about the non-dominant side versus dominant side. And we actually have a new guideline in ICD-10, which I think is an improvement. I think it's a good guideline for these. In ICD-9, we didn't have any specification if it didn't say dominant or non-dominant. Now you can see here that the default is dominant. So if it's unspecified, if our documentation doesn't read that it's non-dominant, we can assume that it is the dominant side. And when we take a look at these codes, the G81, G83, looking at hemiplasia, monoplasia, those kinds of things, we can identify that again as non-dominant or dominant side. And then I do just want to show the laterality on those. So let's take a look at those really quick. Sorry, let me zoom in so we can see better. And we're going to look at G83. Scroll down here a bit. So here's just an example. Here's monoplasia right here. So G83.1, monoplasia of the lower limb, and then notice we have an unspecified side. We have right dominant, left dominant, right non-dominant, or left non-dominant. So we do have a guideline if it doesn't say dominant or non-dominant, but if it doesn't say right or left, then we really just still have to use this unspecified, the G83.10. Also, if a patient is ambidextrous, then we're still going to code that as dominant rather than using two different codes there. All right, we also talked a little bit about the pain category G89. I'm just going to scroll down there so we can see that again. We talked about it a little bit with neoplasms. So it's pain not elsewhere classified. You can see there are quite a few excludes 2 notes, and I'll talk about those here in a minute. And then we have a few different specifications between central pain syndrome, acute or chronic pain. And again, we talked about the neoplasm-related pain, and then we also have chronic pain syndrome. So if pain is not specified as one of these, acute, chronic, post-procedural, something like that, then we're not going to use the category G89. We're just going to use whatever site-specific pain code that we can find. Also, if we know the underlying diagnosis for this, we don't need to code that separate unless they're coming in for pain management. So that's what we looked at with the neoplasm-related pain, is they actually were coming in for pain management. So again, if they're coming in for that, then we're going to code the G89 code first, and then we'd put that underlying cause as an additional code. So in the example of the neoplasm-related pain, we had the G89 code, and then we would have an additional code to indicate whatever neoplasm that is. Also, if they're coming in for a neurostimulator, that would be another case where we would want the G89 code as your principal diagnosis. I mentioned site-specific pain codes, so we still have pain codes for, let's say, abdominal pain or face pain or something like that. A lot of those come out of the R codes. A lot of them are in the signs and symptoms chapter. If the G89 codes will give additional information. So for example, if it says acute abdominal pain or chronic face pain or something like that, then we can actually code the G89 code because that indicates the acute or chronic piece, or maybe it's neoplasm related or something like that, along with that site-specific pain code. And again, in terms of your sequencing, if they're coming in for pain management, we're going to put that G89 code first, and then we can put the site-specific pain code. If it's for any other reason, we'll put that site-specific pain code first, and then we can just put the G89, again, just for additional information if we can get some more specificity in there. Post-operative pain, the default here is acute, and I don't know if we got quite down that far in here. Oh, here it is. Here's post-procedural pain, chronic here, or here's acute post-procedural pain, G89.18. So again, if the documentation doesn't specify, we're going to assume that it's acute, unless it says that it's chronic. If it's just expected pain, you know, obviously after surgery there's going to be some pain there. If it's the just basic routine expected pain, you don't need to code a G89 code. This would be for something that's out of the ordinary. If it's not associated with some sort of specific post-op complication, just the G89 code is sufficient. If there is a complication, we're actually going to code that first, and then we would add the G89 code after that. And then I just quickly want to kind of note the terminology here. Notice that there is central pain syndrome, there's chronic pain, and there's chronic pain syndrome. So these are different definitions in terms of diagnosis. So as a coder, just being really aware of the terminology, really easy to confuse central with chronic. And then again, excuse me, chronic pain syndrome is different than chronic pain. So just watch that terminology when you're coding these. Alright, and I thought that I would start putting the coding demos in with these lectures for at least week 2 because the lectures are going to be relatively short. That way you don't have to pull up 2 different presentations. So my coding demo is going to be complete paralysis of both lower limbs. So I'm going to go over to my index, and I went ahead and already went down to paralysis so we didn't have to sit through me scrolling forever. So I'm on page 944, paralysis, and then we were looking at lower limb. So I do have to scroll a bit. So here's lower limb, and we have C monoplasia lower limb, but our statement is complete paralysis of both lower limbs. So here, notice both, we have to see paraplegia. So I'll have to scroll down to paraplegia. Again, a little bit more scrolling, but not too much. So now we're down on page 950. So here's paraplegia. Notice it's lower, and then we do have complete paraplegia, the G82.21. So we'll go ahead and take a look at that in our tabular just to make sure we're happy with that. We're actually close enough. I'll just scroll up. So here, our category, paraplegia and quadriplegia, paraplegia, G82.21, notice that the 1 specifies that it's complete. And notice that we have paraplegia of the lower limbs. So we get G82.21.